Yes, all right. So thank you very much for giving me the opportunity to talk today about the HaemSTAR involvement with this national project. So it's done in collaboration with the UK ITP Forum and with the Public Health Education, Public Health England. So from early on after the starting of vaccination programs, people have started to report multiple autoimmune phenomenon. One of these is ITP. So this project was started around July last year to look at new or relapsed cases in adults following vaccination, and is defined ideally as within 4 weeks of receiving a first dose of vaccine. That was predominantly related to AstraZeneca vaccine, but cases with other vaccines, predominantly also Pfizer, the other vaccine that we had reported cases with. We at HaemSTAR have been involved from early on, and started mainly from August time, so around end of August, when we started with the data collection. So around October, early October, we had 40 cases, and then that has increased to around 130 cases at the moment. In December time, the UK ITP Forum was able to create a guidance for vaccination in ITP patients. And that basically just recommended checking the platelet count. So doing a full blood count within 2 to 5 days after receiving the vaccine. And it has recommended that people continue to receive their vaccination, and changing the vaccine to another type of vaccine was given as an option. The estimated prevalence of or estimated incidence of IT post-vaccine ITP is around 1 per 100,000 patient. So this is from the initial analysis done in December. So, and again, so that shows the same incidence. So from Leicester, for example, we had around 11 cases, and we have like a 1 million catchment population. So is around 1 in 100,000. Currently, we are getting so close to the closing for time for data collection, and the original time for closing data collection is 31st of March, because according to the calculations made by Public Health England, it was estimated that most cases would have happened by that time. So now we are just extending for another 2 weeks, just for people to submit the final cases, and then hopefully over the next couple of weeks we'll get the data analysis, and we'll start writing up our findings. So that's really all what I wanted to tell you about this project. Thank you very much for listening, and I am up for questions if there are any questions. This is also my email if you wanted to contact me with any questions afterward. Thank you very much.
Just to say thank you very much, Mohammed. We know that we're not capturing as many people as there should be, because you can see the predominance of certain centres there, Leeds, Oxford, Leicester, and there will be lots of these ITP post-vaccine new and relapse. So, please, everybody, just the link's only open for 2 more weeks. Again, it's really easy to complete.
Yes, sir, I didn't catch that very well.
So, Mohammed, it was more of a comment just saying that there's a limitation to the study, which is it's basically relying on clinician goodwill for filling in the data and clinicians' memory of cases, rather than a really robust way of identifying patients. And I think that's acknowledged by, so that's probably more of a comment than a question. I have a question for you, which is just because I think to help people who are then running these studies, what barriers and how have you overcome them have you had for in terms of actually involving people, and sort of how have you managed to garner support for this? Is there any particular advice you have for other people running similar studies?
Well, I think the main impact came from sending reminders with the newsletter and also reminders on the WhatsApp group. So I think that was the main, because we have seen increase in the data submitted recently compared to the initial parts. Again, people were getting in touch by sending emails. So these were the main methods to remind peoples, and is really it was just dependent mainly on memory. So that was a real limitation, and especially that we didn't start at the time of the peak incidence, because the peak was with the first wave. So many people were just presented at that time. So for myself here, for example, I only managed to get a retrospective collection from getting the cases from other colleagues and from other clinicians.
Thank you. I think sounds like Sue has another question.
I think you've done a fantastic job. I think because these people they're picked up in the immunohematology clinic, but they're harder to find than say VIT, which is so evident, these people require admission. It's harder to find them, so it does require a dialogue with the consultants who are running the ITP clinic to say, look, there's a link, we need to have you got patients that you know of that I can add to it? And I think probably the awareness amongst registrars is probably better than it is amongst consultants. We do run the UK ITP forum, we keep reminding them, but I think if you can just take that up with your ITP clinic lead and just offer to patients, that would be fantastic way of doing it.
I mean, I think what I'm hearing here is there needs to be almost one last push for spamming people's emails and Twitter accounts to remind them in the next 2 weeks to finally input all their data on this. And there's no registration required, is there? Because it's all via a PHE link, is that right? So
that's correct.
there's no barrier of audit departments. Yeah, okay.